Well, welcome back. This is week 2B, right? To be or not to be. Hopefully that is the hypothesis or the research question. I know, I'm sorry. Forgive my lame joke. But in this part of our week, we're going to really look at the research question. So how do we construct a research question? How does it relate to a specific aim or objective? And then what's a hypothesis, right? So we've used these before, and I know you've probably had hypothesis testing when you took stats and things like that, but in this class, we're really going to go kind of behind the scenes and understand how to construct them, and then what they really mean to us when we're out in the real world, working with people and, using research. So let's begin. Research questions, dun, 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 right? A research question, when we say it, it's used a couple of ways. So it can be in a broad sense, like the question that guides your study, whether it's quantitative or qualitative. But in a qualitative study, a research question can be the equivalent of a hypothesis. So when you say research question, it's generally the question that's guiding the study. And we need them, right? How do you know what you are looking for? How do you know if you found what you're looking for? You need to really carefully construct a research question, right? So you want to solve a big problem, but you need a testable question to have a solution. And it's really, really tricky. So I'll give you an example. I'm working with someone in the National Institutes of Health. I want to look at some relationship of providing care, right? Care and support in the home for families and people with someone who has a form of dementia called Alzheimer's. And I have to formulate a one-page statement of my research questions. And I've been doing this for over 20 years. And when I got the email from my program officer, I froze. I'm like, oh boy, she's going to judge me based on my research question writing, right? So no matter how long you're in the field, research questions are always hard to really take from the big picture to narrow down to something testable. But you can do it, and we'll find steps for it. Right? So the way that we do it, and later on I'm going to give you a brainstorming exercise, but we brainstorm. So it's like, what do I want to study? And I'll come back to this a little bit later, but I was talking with a student of mine, and she works for the VA. And she was very interested after Katrina hit Puerto Rico, how services like home care services and home and healthcare services were provided for veterans. And she's like, right? How am I going to get a research question? I really want to look at what's happening. I want to understand how those services were built up. Were they sustained during all sorts of emergencies that happened around Katrina in Puerto Rico? So this is kind of what she did. She was like, later on, I'll give you her general research question, which was qualitative based on what she wanted to learn. But generally you think about, like, what's a population? Do I want to study people in my own practice? Do I want to study a condition? Maybe, autism. Maybe you want to study people with problems with gait or walking, or people with a health condition, right? It can be, you can always reach out to the literature. You can always reach out to theories in your field. So what do they say about this condition or problem? What's the literature telling us, right? When I'm reading the literature, all these studies are doing this, but I'm thinking there's got to be a better way, or I want to test what's happening in the literature. Does it work for groups of people that I work with? And Jacobson does this kind of thing, your author of your text, right? You have to think about your research. Like, is this research meaningful for you? So is it meaningful for people who are practitioners of physical therapy, for clinical counselors, right? For, hospital administrators? Is it valuable? And then, do you have what it takes, right? You may want to do this research project, but again, the feasibility. Do you have the time? Do you have the knowledge? Do you have the resources to conduct a study? And then what's available, right? Do you have the data? Do you have the materials you need? Do you have the data analyst? All sorts of stuff. And then what's useful? right? Will it help your career? Will it help you get promoted? Will it help your patients? Will it help your clients? Will it help your graduate work, right? Do a thesis or, work on a capstone or a project. And then what knowledge is needed, right? A lot of research is driven by this idea of gaps, right? What's the gap in knowledge about this topic that we want to fill? This is another way of phrasing it. I want you to think about this piece here, mentors, right? That you may work with a team of people, and there may be a research question that's of interest to your director, your chair, your CFO, your CEO, and then that may be something that might direct your research. So it might be of personal interest, but it might be something you want to solve. When I worked in healthcare, we wanted to make sure that that there was efficacy in any intervention that we launched in the hospital. So we did pneumonia protocols, we did diabetes protocols, we did congestive heart failure protocols. And my supervisor, when I was a project manager, wanted to know, was the cost of the protocol worth the benefit of health outcome to the clients or to the patients? So that was something that I was interested in, but also it was driven by a mentor or a supervisor. Right? Brainstorming works, right? What are you thinking about? Once you get your idea, I'm interested in, I'll give you my students example. I'm really interested in home care post emergency events, right? Home care post Katrina is really looking at providing home care to veterans in an emergency, right? This is a natural disaster, but an emergency situation. So what do? We search, excuse me. So you can search in the National Library of Medicine, and you can also search the literature through your library using search terms. We start out broad and we go to terms that are more concise, right? More detailed. Let's just see. I'm gonna give you, I'm going to give you an example. 1 second. Let's examine this a little bit more. Just so we can look at it together and kind of see what it looks like. Pop that in there. Right, so you'll see in this, these are medical headings. Gives you the history, talks about terms. And when we get to a place like this, what I would definitely tell you is always reach out. We have a wonderful librarian called Carrie Price. You can always reach out to her, and I'll put her information. I'll put her information in Blackboard. I'll send you an email, probably not an email, I'm sorry. I'll put a link with this video for Carrie Price. So Carrie can walk you through, and it's one of the most complicated things that we think should be simple, right? It's like, why can't I find the literature that I want? Why can't I find the literature about this condition or this disease or this population? It's probably because we have the wrong search term. And librarians spend years and years searching this, like, how do we understand medical terminology in library searches? And I think they're definitely a resource. So I'm going to link to Carrie Price. You'll see a link for Carrie in the same, underneath this video on Blackboard. And I really encourage you all to meet with Carrie and reach out to her, especially when you're thinking about the articles you're going to choose to write up and the articles you're going to choose to present in your video presentation. So Carrie's a great resource. I would reach out to her. You can give her the assignment. She will know the assignment. She'll work with you. So when you have a keyword and you're looking for a key term in the literature and searching, you're not sure what database, you're not really sure about what mesh term to use, Carrie is your librarian, 100%. So these are ways you can do it, right? Brainstorm. I'm a big free writer, right? Free writing, I think, is underrated. just write down stuff. If you journal, right? If you scribble, right? Write down stuff, any words that come to you, right? I'm looking for veterans in Puerto Rico, have home care, it's natural disasters, it's emergencies, but wait, it's really the VA system. But wait, it could be telehealth. But wait, I'm really interested in, what am I interested in? You could do that meta review. You could look in literature. Is there a review of veteran services that during disasters or times of emergency? Maybe another emergency, someone did a meta review of literature. Can I read some peer review articles? So do a lit search, see, you know, the experience of veterans getting home care during natural disaster or disasters or emergencies, and see what you can draw from that when you create your research question, right? What exists, what doesn't? What are people saying about this topic that I'm interested in about veterans and home care post, post Katrina? Then when you have a research question, you also have to fit it back, right? So my research question about the experience of veterans getting home care post Katrina, it fits into literature in many ways. It fits into home care literature. It fits into literature about the VA and veterans. And it also fits into literature about disasters. I have many friends who just study disaster-based research as nurses. That's a whole field of study. Right? What's the scope of the question? Her question's pretty broad now, and we'll narrow it down. And then what's the goal of the study? Her personal goal of the study was to understand the experiences of veterans directly. What did they think about receiving home care post-Katrina, and also providers who are doing the home care? As we could imagine, what is the experience of trying to provide a system of home care, a home care network post-Katrina in Puerto Rico, right? So she wanted to really understand like the feet on the ground experience from both those groups of people. Good research questions, they got to be interesting, right? It's the thing, the whole hum, so what? What's the so what, right? It has to be relevant. You know, there has to be some group that will benefit or care about the results. It has to be feasible. If the student said, I don't have access to any veterans who are in Puerto Rico post-Katrina, I can't get to veterans, I'm not going to do a Zoom study or, you know, a virtual study. I don't have any access to providers, nor do I have access to the VA. Not feasible, right? Is it ethical? You could question and say, is it ethical to study people in a time of great crisis? That's why we have IRB. In the US, we have the Institutional Review Board that sits and reviews research and will grant you approval to do your research or suggest tweaks before you go out in the field. In abroad, they have ethics panels of all different names, but you have to say, is it ethical? So in this case, the VA study did get ethics board approval from the VA ethics panel. So from the VA IRB, the Veterans Administration IRB. And is the study concise, and is it answerable? Is the question testable? And I'll show you as we go forward. So this is what I thought, if you want to take some time, right, and give it a shot yourself, right? If you're thinking about not necessarily a research question, but I want you to really think about what topics you're interested in. So when you're doing your article summaries, or you're doing your video presentation, and you're like, I'm really thinking about a lot of topics, I like a lot of stuff. This is something you can do, and you can do this after the video and take a few times to do it, like even 10 minutes. You just sit back and you say, what is the topic you're interested in? Why, right? What do you want to learn about the topic? And then what steps do you need? What steps do you need to learn more? Do you need to look into literature? Do you need to do a literature review search? Do you need maybe to talk with a mentor? Do you need to talk with colleagues? Do you need to see what's out there in your professional field? What are people doing? What are clinicians doing in this, you know, with the topic you selected, right? So you could outline it, you could draw it. So if you're really pressed and thinking, I don't know what topic I want to, you know, use for this class, try it, right? Take some time and do this, right? So it's a good exercise. So you can also generate your research question by clinical observation. And this is the personal, right? The personal is political in the sense that, you know, much of the research, like I sat with Jack Rowe, who did successful aging and came up with theories of aging. He was a stellar clinician. He still is, and he would sit at the bedside and observe. And his big thing was, how do we train residents to really be more empathetic and be more patient-centered? And how did he learn it? And why did he come up with this? Because he watched residents engage with patients. And he was like, there's got to be something we can do to make this better. His idea of making clinical interactions with patients better, or person-centered care better, came from, how do we do this? It could come from theory, like you're reading an article or you're reading some theoretical notes in a journal, and you're like, I wonder if this really works for the group I'm working with. Or your professional literature. Everybody in the field is saying this is the right procedure to use. Everybody's saying this. I don't know. I don't know if it works. I don't know if I'm going to use it. You could test it, create a research question and test it. And Jacobson gives you a couple ways. So we're going to give many ways of taking a research question and making it more testable. The first one is this exposure disease population kind of relationship. Exposure is the trait or attribute. Disease is a condition or a physical health issue, and population is the group. So you could create a hypothesis, a research question that brings in exposure, disease, and population. Is household income, the exposure, related to obesity, the disease, in preteen children living in Arizona? You have the exposure, you have the disease, and you have the population. But as I said, there are many more, and we'll go through a couple more in this presentation. Right? You have to think about ways of narrowing down a focus. So you may say, I'm really interested in therapy and autism spectrum disorders. That's excellent. But here's a way of making that general theme a research question. So can a modified cognitive behavioral therapy program, is a modified cognitive behavioral therapy program effective at treating anxiety in teens with autism spectrum disorder? Or you could take it this way and say, you're interested in ways of healing pressure ulcers. And you could say, does electrical stimulation or negative pressure therapy promote healing of ulcers, right? I'm interested in what will help ulcers heal, and I'm going to narrow it down. You have to be curious, right? What makes the best researcher? Somebody who's got the fire, like, I just don't like this. I need to figure this out. This is not working. What's going to work for my population, my group, my practice, what's going to work for the clients I work with? What's going to work for the policy I design? You have to have that burning desire, right? You have to feel it and engage in it. So research questions have they're very needy. Research questions are needy. They need a lot of things. So the research question needs to be worth time and effort. So the thing that you're going to learn at the end of the research has to be worth the process. It has to have some benefit to people. So who's going to benefit for this, right? Who's going to benefit? Will it benefit the people you serve, right? Will it benefit the people you work with? Will it benefit your field? This is, again, that so what test. Is it just, are you doing it? Why? So what? Are you going to learn something that's just academic, or find some reject or fail to reject a hypothesis? Or is this really going to impact the lives of people? The research questions, again, they're needy. They have to be testable. So if you say something like mental health is important or tobacco use is bad, not a research question. These are not research questions. These are statements, right? Statements, they're not questions, right? You cannot say something like people should exercise more or first aid should be mandatory as part of the middle school curriculum. These are recommendations or conclusions, not research question. If you said something like, I want to study if people should exercise more to improve their health, or should first aid be a mandatory part of middle school curriculum? question mark, yes. Research questions explore, they don't make statements, and they don't come to predetermined conclusions. That's not what they do. So then the question would be, so how do I do it? Right? So you're telling me all the things research questions need to be, but how do I do it? So we can go back to the example of home care post-Katrina in Puerto Rico in the VA system. So, right, select a broad area, generate all the questions you can think of. So I'm interested in this, healthcare post-Katrina for veterans in Puerto Rico. I could look at, the quality of life for the veterans. I could look at the level of difficulty for the providers. I could look at the gaps in care or where services weren't available. I could study the process of reconstructing care networks or rebuilding care networks. I could look at personnel shortages, right? Write them all out and cross through, right? What am I really interested in? And a lot of these aren't researchable, right? Can I research many of those things? No. Researching the process of reinstituting a system of care after the fact is very difficult. How can I see how people reconstructed care when we're a year or two after the event, right? We might have missed that mark, so cross through. And then refine the questions. Do you have any bias in there? Or do you have any statements in there? And this example was for the student was really a very general research question, but one that lent itself to qualitative research. And it was, what were the lived experiences of veterans and care providers who were living and receiving or providing care post Katrina, Hurricane Katrina in Puerto Rico, and she gave it a 6-month interval. So she gave it a time interval as well. And that's something she can access. That's some information or data that she can gather. So is her study feasible? She's got resources, right? The VA is supportive. She's got research subjects. We know who receive care, and she's got practitioners who are part of the VA system. Does she have expertise? She herself has been trained extensively in qualitative research, and she knows the knowledge and the science, and she has time. This is actually part of her doctoral dissertation. So master's work, doctoral dissertation. What are the ethical implications, right? Think about this. The IRB was very interested in whether interviewing veterans, post-Katrina receiving this care, would this induce secondary trauma? Would this re-traumatize people who are living through a traumatic event, right? How could we do this study without instituting any harm? And if we have any sensitive issues or issues that would require referral, can we refer people out to receive care? And let's go back again, right? If you're doing population research, these are ways that you can, if you're doing hypothesis testing, these are ways that can generate hypotheses. Remember, we had the exposure before. Is having more income. Let's see, let's go back. I can't recall the statement. Right? Is household income exposure related to obesity disease in preteen children in Arizona? So we talked about this, looking at a research question with exposure, disease, and population, but we can also, forgive my flipping, we can look at another approach, which is PCOT, and it's used a lot in clinical population-based research. So what is the patient, right? Instead of identifying exposure, disease, outcome, and population, you identify patient or population, problem, intervention. It will be compared to what, and what is the outcome of interest within the time frame for follow-up. So I'm going to share this one with you. I wrote an example that I thought really worked. So you could say in an adult population, right, post heart attack. So the patient or populations are those that have experienced a heart attack. How effective is exercise? Exercise is the intervention compared to medication in recovery, right? In full recovery or rehabilitation outcome when post-discharge or leaving the hospital, right? So you can go through and use each of these categories and really say, this is my population, this is the problem, this is the intervention compared to those that did not receive exercise versus non-exercise or versus medication. What is the outcome? Like successful rehabilitation, post-discharge, right? It's a formulaic way of looking at a research question. And this diagram I created, or this visual I created, to give you the sense of how things fit together. So you have a study goal, which is overall. You have a research question, but how do you test the research question? You make specific aims, objectives, or hypotheses, right? So it's something measurable. And the study goal is, right, your main overarching goal, right? It's not a question, this is more of a statement. I want to assess the perceived health-related needs of the community. We could use that for the veteran study. We could use any of these, right? It's just to identify, to look, to measure, to evaluate, to understand a complex phenomenon, to examine the impact of a program or policy. So let's say, for example, the VA study I'm speaking of, it's to understand a complex phenomenon, right? Providing care post-natural disaster. That's the goal. The goal then has more specific objectives, right? It could be in the form of a question, right? To research the experiences of healthcare providers and veterans who were living and receiving home care in Puerto Rico post-Katrina. When you have an experimental study or you have a quantitative study, generally your specific objectives become hypotheses, right? They're the measurable steps. And they can be sequential or independent, meaning one objective can lead to another, or they can be separate. And then what is an objective? It has to be specific, measurable, attainable, realistic, relevant, and time-bound. So it's the difference between an objective and a goal. A goal is more broad. My goal is to study, this, right? But your objective will kind of hone in and make sure that it's measurable and answerable, right? So, is there an improvement in performance for clients who take this intervention, within 6 months? Or is, an objective may question and say, the objective is to have a 20% improvement in outcome after this intervention. Objectives are more concrete. And again, back to quantitative, qualitative, that a quantitative research question often says subjects, participants, right? Uses both, right? But generally the way that we see it is if someone says, who are your participants? And they would say that to you, I would say they're going to do a quantitative study. If somebody says, who are your participants? It could be qualitative, but this language overlaps, as you saw me say for quantitative, right? So a quantitative researcher may say, these are my participants or participants in this intervention, but more traditionally, they'll say subjects. But it's good just to think about the language that we use when we talk about people who are engaged in research. Hypotheses, right, plural, are a prediction, right? I'm making a prediction between two variables, right? What do we hypothesize in this particular piece from a research article? That patients fearful of dental work who take part in this relaxation and guided imagery course they should have less anxiety, right? This isn't kind of obvious, but it's a prediction that we're making. So those that attend this intervention, which is a guided imagery program, they should have less anxiety than who? Than those that do not take part in the training, right? So that's a hypothesis. Hypotheses are made up of variables, and variables are things that vary, right? Those that attend the guided meditation, those that don't, those who have fear of dental procedures, and you could rate that on a scale, right? Who have a high anxiety, moderate anxiety, or low anxiety. And again, a hypothesis has to have those two variables, right? You know, which I'll give you in a second. We'll go through a hypothesis. The independent variable is X or IV. The dependent variable is Y, and then you can have a direction of relationship, right? If we increase the amount we spend on healthcare per person, we predict that satisfaction with healthcare will also increase, right? Two things are related. We're making a prediction of direction between one and the other. And we'll talk about in more detail later, but level of measurement and then how level of measurement and hypotheses work. But just you can hold on that for now. Again, general hypothesis statement. If one variable increases or decreases, the other one will, right? More spending on healthcare, greater satisfaction. More spending on healthcare, we will have, you know, I don't know, we will have less dissatisfaction, right? You could change the direction, right? This makes perfect sense. They have to be based in theory, the hypotheses that you make, they have to be reasonable, they have to state the relationship between variables, and they have to be testable. So before the hypotheses I gave you, if you think about it, they were directional, right? An increase in one or change in one is related to a change in another given a direction. So if we increase the time we spend with our clients, we will also increase their knowledge about the treatment or procedure or plan of therapy we're conducting with them, right? We're making it a directional statement, increase, right? If we increase the number of staff, we will decrease the wait time when somebody hits a call button, right? This kind of thing. If you don't care, you can just say that a change will be related to something else. So, you know, a change in A will be associated with B, but you don't care about a prediction, you know, right? So it's more general. Statistical hypotheses, and I'm going to go into it a little bit in the next slide, but I just want you to think about a statistical hypothesis begins saying there's no relationship, which may be counterintuitive. So the null, it's also called H subscript O, right? The null, and it just means that there's no relationship. So the whole thing you're doing when you're hypothesis testing is you're trying to reject the null, right? Or fail to reject the null. You want to reject the null. You want to reject that there's nothing happening. So that's kind of what you're thinking, you know, when you do it. But when you hypothesis test, we always start with the null hypothesis. I stuck the coin toss in, but sometimes I think it might be a little bit more confusing. So I'm gonna skip it. I think the main piece here that you want to think about when you look at this slide is that the null hypothesis is saying that the relationship is happening from chance, and it's not happening because there's a relationship between the variables. It's just occurring randomly by chance. Hypotheses are never right. You can't say, oh, my hypothesis is right. It's true. We say it's supported, not supported. You can reject or fail to reject the null. And that's how we verbalize it. So we've gone down a lot of roads about thinking about research, right? Research questions, why we pick a topic, how we study a topic, and I want to tie it back to you. So you're going to kind of face the same dilemma. You're not conducting research, but you are critiquing research articles, and you are the sole person picking your topic, right? How do you choose the topic? Brainstorm. What are the things I'm interested in? What are the challenges I'm facing in my practice? What are the issues I'd like to learn more about? How can I make it narrow if it's too broad? Or if it's too narrow, like what's happening within my own personal private practice, how can I make it broader? Do the same thing, brainstorm, jot down, take that 10-minute brainstorming exercise that's earlier in this video. And before we go to, or before I leave you, I want to also have you think in this way, right? That what are some unanswered questions? So if you're really struggling to think about topics, what are some unanswered questions regarding the clinical or population health in your profession? What's a topic that you personally, you see in your work, you see in your research or your study, in your field of study, or even in your reading for school that you really want to research? And then how will you explore this topic? What is some issue or some aspect of the topic you want to explore more? And then why do you think it's important, right? I'm going to leave you with that question of so what? What's the so what piece? What's the, after you do the article review, after you read about your topic, what would you like to learn? What would you like to gain from doing that exercise? So think about those things. If questions come up, reach out. Again, I will put the number for Carrie Price right within your week 2 where you're seeing this video. It's going to be in week 2. I'll put a little item for Carrie Price and contacting our research librarian if you want to reach out, learn mesh terms, or start working on your topic for the course. Again, thank you for being here, and thank you for viewing the video, and I will see you next week.